What's up, guys? I'm going to show you how to increase shoulder external rotation. So there are two different techniques here. One involves the patient lying prone and then using an anterior glide, but since they may sublux in that position, we decided not to do that. Instead, we're going to use a distraction force while they are laying supine. This is my patient here. He is having decreased external rotation because of frozen shoulder, and he is in the subacute phase. So I'll just quickly go over the convex-concave rules here. So we have a convex humerus, and then we have a concave glenoid fossa. So with regular external rotation, you'll have the head of the humerus rolling posterior, and then it will slide anterior. So that's why you would regularly do an anterior glide. Okay, but instead we're going to do the distraction like I said. According to Colby and Kisner, in the subacute phase, you're going to want to do a grade 3 distraction force, or you could do a grade 3 and 4 oscillation force, but we are not going to do that. So for this, you want your patient laying supine. You're going to put the glenohumeral joint in the loose pack position, so 45 degrees of AB adduction, 30 degrees of horizontal adduction. Then you're going to take their shoulder and externally rotate it to the max. Going to take your other hand, put it in their axilla, and provide a grade 3 distraction force, so putting it into the tissue resistance. So once you get to the resistance, then you can go into it just a little bit. So you're going to provide that, and you're going to hold it for 7 to 10 seconds. Okay, after the 7 to 10 seconds, you can take it back just to where the tissue resistance starts, and you can hold it there for 3 to 4 seconds. So you can continue to do that. And again, this is to increase shoulder external rotation. Just a disclaimer, because of the circumstances, I did not have the best body mechanics, but that is because he's on a couch and not a treatment table. So just a disclaimer. What's up, guys? I'm going to do a hamstring stretch, specifically a hold relax agonist contraction. Just a disclaimer right away that my body mechanics will not be the best since I am not on a treatment table, but instead I am currently on a bed with my patient. So we're going to get started right away. Patient position is supine. You're going to want to get yourself in a good position so you can control all of their movement. So I like to straddle the leg not being stretched, and you can bring their leg up. So you're going to want to move the hamstring into passive insufficiency, so that would be its longest. So you're going to move it up, and then you're going to move it all the way into where you can feel resistance. Your top hand will be at the ankle. Your bottom will be making sure that that knee continues to be straight. So move it into resistance. So first we're going to do the hold relax. Okay, so I'm going to tell him, push into my hand as hard as you can. And you're going to have him do that for 5 seconds. Okay, and then you're going to tell him relax, and immediately when you tell him relax, you want him to have a concentric contraction of his hip flexors, bringing that into the new range, and you're going to have him hold that for about 10 seconds. So with this stretch, with the hold relax, you use the GTO inverse stretch reflex, and then with your agonist contraction, you're using that reciprocal inhibition. So you're using two different things to get into that new range for stretching the